Intravenous, 4. Drip rate controlling and monitoring for risk-free for delivery. Mohammed Arfan B. Automate India PVT Ltd Bangalore India. Lavanya RB Automate India PVT Ltd Bangalore India. Abstract Intravenous, 4. Drip mode is one of the most used modes for drug delivery. It delivers the drug into the blood circulation directly. It is widely used because of its advantages like its affordability, safety, effectiveness, and speed of delivery of pharmacological substances and other fluids. Albeit its many advantages, a few complications could arise in its usage if it is not administered properly. In this paper we discuss the advantages and risks of 4-drip set, the importance for drip rate, existing infusion pumps and their drawbacks, attempts made to overcome the drawbacks of infusion pumps, and finally the need for next generation 4-drip set which can not only monitor but also control the drip set. Keywords: intravenous, 4, drip monitoring system, 4-drip set, drip rate, fluid administration, infusion pump, gravity drip, backflow, over infusion, under infusion. Introduction. One of the main activities in clinical medicine is the treatment of diseases by pharmacology. This is done by supervising the medication by various methods like oral, intra-arterial, intramuscular, subcutaneous, and intravenous, 4, routes. 4 therapy is the administration of fluids, and other medications, into a vein directly. Intravenous, 4, route is the fastest way of delivering medications and replacing fluid throughout the body. 4-drip/blood meter is extensively used in clinical and home care settings to treat conditions such as severe fluid loss, pneumonia, dehydration, electrolyte imbalance, anemia, high fever, etc. The main perk of 4 is that the fluids can be delivered in the fastest mode throughout the body and immediate effect of the medication can be achieved. Also, a few medications cannot be given by any other method other than 4. In 4 therapy, the medication is 100% bioavailable and it is relatively inexpensive. Though 4-drip is an effective tool, yet many complications can arise if it is not done right. Numerous complications like biochemical disturbance, hemodilution, renal impairment, hypersensitivity, etc. can occur as a result of fluid therapy. Hence monitoring and controlling the drip rate of 4 fluid becomes very crucial because any slightest change in the drip rate of 4 fluid might cause severe side effects. Review survey. According to the stakeholders' feedback, the following conclusions can be drawn, which are represented by the following figures. In any hospital, due to fewer nurses, their job could be simplified to a great extent by 4 monitoring and controlling device. Blood backflow can be avoided by the help of monitoring device. This device would make the nurse's job easier up to 81%. Also, it would be easier to know the reservoir level for injecting additional drugs to the drip bottle. Area of concern. Stakeholder feedback on the major issues while using 4-drip set gives the following statistics. As per our survey, there is 70.6% need to keep track of the 4 fluid that is being administered. The accuracy of the drip rate is 44.1%, whereas clotting at site of administration is 55.9% and blood backflow is 38.3%. Drip set, its advantages and risks. There are a range of medical conditions, which require intravenous therapy, including severe fluid loss, e.g., due to burns, dehydration, pneumonia, electrolyte imbalance, high fever, etc. Substances that are usually administered through intravenous route includes buffer solutions, nutrition, blood-based products, volume expanders, blood substitutes, etc. There are some fluids that are often routed by gravity feed through a type of constriction, which allows to control the fluid being administered. Almost all the clinical intravenous fluid administration set will include a fluid reservoir, and a capillary tube of fixed diameter for fluid to pass through, called a drip chamber, and the drops formed will drip from tube into the chamber when they reach certain volume. To produce a fixed number of drops per unit time, the clinician adjusts the flow rate. Here, the driving pressure is the difference between the hydrostatic pressure generated by the column of liquid in the intravenous set and the venous pressure. Since the latter is typically around 4 to 8 mm of Hg, the driving pressure is approximated to be the column of liquid. The reservoir is usually adjusted 60 to 100 cm above the patient. Intra-arterial injection is impractical as it requires raising the reservoir to around 2 mts. The drop factor, also called the drip factor, of a drip set is the number of drops which make 1 ml of solution. It is drip set specific. Now, drip sets are available in various sizes and shapes and with a variety of drop factors. But, the most widely used are the micro drip and macro drip. Macro drip, regular drip, takes 10, 15, or 20 drops to deliver 1 ml of fluid. They are used to infuse greater volumes or infuse fluids quickly. Micro drip tubing takes 60 drops to deliver 1 ml of fluid. It is used to infuse smaller volumes or very precise amounts of fluid. Intravenous fluids are to be given at a specific rate, neither too fast nor too slow. The specific rate may be measured in drops/min, ml/min, ml/hr, liter/hr and others. Importance of drip rate. The following are the reasons why drip rate should be monitored. The drip rate set by nurse can change due to various reasons. A few are listed below. Composition, concentration, viscosity of fluid in the reservoir. Changes in patient's position. Height of reservoir above the patient. Occlusion of the device, e.g. due to an inflated BP cuff. In addition, the variation in the cross-section of the patient's vein can affect the flow rate. Reduction in pressure as the reservoir volume decreases will decrease the flow rate. Patients occasionally adjust the roller clamp or other parts of the delivery system. Medication error may lead to under-infusion or over-infusion. For some drugs whose therapeutic levels are close to their toxic limit, then administration of this type of drug might lead to suboptimal therapy or have toxic side effects. Under-infusion is the situation where less fluid than intended is delivered to the patient. Under-infusion may result in following consequences: dehydration, metabolic disturbances, a delay in response to the medication. Over-infusion is a situation where more fluid than the intended is delivered to the patient. Consequences of over-infusion include metabolic disturbances, shortness of breath, high blood pressure, electrolyte imbalance, speed shock, etc. Overhydration must be prevented, particularly for patients who require small volumes of fluid. Overhydration can lead to edema and death. The problem of flow control of drips affects the following client groups: infants, children, geriatric, organ impairment or organ failure patients, patients with impaired cardiovascular status, patients with major sepsis, post-operated patients. India and many developing countries have the hospitals massively overcrowded and understaffed. Uniform size of bags adds to the problem. 1 liter and 500 ml is most common in the developing world. But these bags are too large for client groups mentioned earlier, who need only a part of that fluid. Drip rate varies with variation in different parameters like, for fluids, for the time duration within which an amount of fluid should be given, for different age groups, for different diseases, for micro drip or macro drip, etc. For example, the variation in the drip rate for daily fluid requirement in pediatrics is as tabulated below. Attempts made to overcome the drawbacks. Attempts were made to overcome the challenges with adaptation of drips. A few are discussed below. The traditional method of infusion were replaced by using embedded system technology, a system for detecting the variations in light transmission between a LED and a photodiode placed around drip chamber to monitor drops. This system was designed to run with a battery, but it does not have a regulator to save battery power. Another drip monitor based on optical sensor called AccuFlow was commercialized, and the results of its evaluation were reported by Shrofa et al. The device displays the flow rate and has alarms which operate when the rate deviates from preset value. Other companies like Shift Labs tried to develop compact drip monitor Drip Assist, which was also based on optical sensing. Vinali et al. Reported on design of an stand where an alarm for low fluid level is also proposed. They have used combination of LED and phototransistor for monitoring the drip rate to provide alarm. Various research groups have used methods other than optical sensing to monitor drips. These include capacitive sensing, piezoelectric sensing, ultrasonic sensing, and also microwave time domain reflectometry sensor, which is applied to side of the drip bottle/bag. Thus, existing approaches are limited to monitoring of drip rate. While the optical sensing of drips is promising, other approaches have many disadvantages, like they are complex, not reliable, and not affordable, and are not in the market yet or not being used widely. Existing products. Few drip rate monitoring devices already exist, like Drip Assist, Drip Alert, AutoClamp, etc., which are accurate and stable fluid infusion devices. These devices monitor the drip rate and alarms to indicate if there is any deviation from the preset value of drip rate. A few of the existing devices are mentioned in detail below. Drip Assist Registered Infusion Rate Monitor. Drip Assist Infusion Rate Monitor device is known to deliver precise and fast infusion. It can manage and monitor drip without pump, easily, and can use gravity infusion. There is no need for the following parameters like maintenance, calibration, or asset tracking. It is a small device and has appreciable versatility and portability. The drip count is accurate and reliable for any fluid or medication. AutoClamp. In AutoClamp Registered, the medication is administered to patient with precision and safety. The rate of flow of the fluid is detected when the drops pass through the infrared sensing device. At the lower compartment of the drip chamber, a controller enables to set the desired infusion value to adjust the flow rate. No other tubes are used other than the tubing set for AutoClamp Registered to get precise readings. Drip Alert device. Drip alert device is a simple device which alerts by audio and visual alarm if there is any variation in the drip rate or instability or if it deviates from the required drip rate set initially. Conclusion can be drawn that out of all the existing products that existing approaches are limited to measuring of drip rate. Advantages of drip rate monitoring devices. Accurate and stable fluid infusion. Operation is simple. Care and time of nurse is minimized. Easy to use. Audible and visual alarm function. Disadvantages of drip rate monitoring devices. High maintenance. Specific to a single drip set. Bulky. Not cost effective. It only monitors the drip rate. 7. Need for an accurate automated system to monitor for fluids and control as well. It is clear from above mentions that an accurate, automated system to monitor and or control fluid administration through 4 drips which can be applied at home as well as at clinics, under limited resource setting by respective caregivers to prevent associated complications is necessary. The above figures, Fig 10 and Fig 11, clearly depict the shortfall of the staff in developing countries like India and how vital it is to reduce the burden on doctors and nurses by introducing modern solutions that can be developed by using technology. Conclusion. Not only is the usage of intravenous, drip very significant and crucial in pharmacological drug delivery, but if it is not done right, then it has severe impacts and side effects. Drip is surely a safe, affordable, and effective tool, even then several complications might arise in its usage. Hence administration of the fluid should be done very carefully. Only by tackling the problems encountered in the usage of drip, minimizing its complications and improvising its accuracy, we shall be able to provide the required care to the patients. Hence there is need for design and innovation of next generation drip set which can not only monitor but also control the drip rate according the requirement. The device should not only be simple to use but also cost effective and affordable to all human strata. Acknowledgement. We thank our team members and mentors at Automate India Private Limited for being compatible and helping us complete this project with their perpetual enthusiasm and hard work, as well as our friends and family for their constant support.